I heard a psychologist talk about fear of flying, how you can, if you're afraid to fly, how you can make flying easier. And it was really simple. Get a good night's sleep, exercise before you go, avoid caffeine or tobacco stimulants, and eat a good breakfast, and fly early in the morning. And so we applied those to dentistry, and we found it made all kinds of difference with our patients. And so the very worst conditions were to see a stressed out female, because they get stressed out more often than males, stressed out female at the end of the day after 6 cups of coffee who hadn't eaten. And it's like working on a wild cat. And if we flip that and do a first thing in the morning appointment, after a full caloric breakfast, after exercise, after a good night's sleep, the entire equation changes. We get much better anesthetic. It's much more comfortable for the patient, and then we have a Jack's Secret Sauce on here, and it's really out of Star Trek. In Star Trek, the theme of the movie was whenever they got into trouble, all they had to do was click and beam me up Scotty, and they got out of trouble. Well, this little hog clicker, we used to have little alligators and little turtles, but they stopped making them for children. But this dog clicker, if you just give it to the patient and tell the patient this is for drowning. What do you mean drowning? Well, we put you on your back and run water in your throat. It's called waterboarding. This is for drowning. This is for you need to swallow. This is for if you need a restroom break. When we put somebody in the dental office and you give them anesthetic, the first thing people have to do is they have to use the restroom. We know it's normal. We want you to use the restroom. We don't want you fidgeting, thinking, when is it going to be done? I have to go to the bathroom. So it transfers control to the patient. And the last thing is, if you feel something that you don't want to feel, not if you can notice something, but if it's uncomfortable, at any point during the appointment, you can stop us. Or if you just have questions or you want to mess around with us, you can click it. But just giving that mechanism to the patient lowers anxiety. With lowered anxiety, threshold for discomfort is much lower. Back to the original question, does there have to be discomfort or pain with dental procedures? We can't always make it perfect, but we sure try hard to make it as comfortable for the patient as we can.